Hi, my name is Petra Svarc. I'm a PhD student at Rigshospitaal in Copenhagen, Denmark. So the background and inspiration for this paper were two of our patients that have severe hemophilia A and are also candidates for prostatic artery embolization. And they were really motivated to have the procedure done because it is less invasive than some other alternatives. And that is especially important for people that have bleeding disorders in their history. The rationale for this case report is just to get our algorithm out there and to help other clinicians and other patients feel more secure in a way when they are about to go through the prostatic artery embolization or any other procedures, and just to show, yes, we did it and it worked, and we have this protocol that's published. You can try replicating it, or you could try doing something on your own. But it worked for us, and yeah, I think it will just be easier for also the hematologists that are not so well acquainted with PAE or other interventional procedures, just to serve a sort of a guideline for what they should do or how they should form their own protocols. Yeah, the algorithm itself, it is aimed to hematologists because it is them that are included in day-to-day management of hemophilia patients. But we think that also we as interventional radiologists should know something about the history of our patients and how clinicians manage them. And patients always come up with questions during the procedure. So I think it is also important for interventional radiologists to be able to answer those sorts of questions and say, why did we increase the dose of recombinant factors? Why did we add tranexamic acids to the protocol? What are the possible bleeding complications? So we have exercise bleeding, we have bleeding from self-prostate, we have bleeding from the urinary tract system. So I think the two specialties could be equally interested in this short and case report we published in CVIR Endovascular. Well, I think the ultimate benefit for patients would be that they feel a bit more secure when they are about to undergo an interventional radiology procedure, because they know that it has been done before and it has been done before successfully and without any bleeding complications. We had a small sample size, I assure, of 2 patients, but we hoped it is going to inspire other research groups to try and do some prospective studies with a larger sample size. Yeah, and as patients with bleeding disorders, they're used to managing their own disease, and they are very well informed about all the different drugs they have to take on a day-to-day basis. So I think it just gives another layer of security for them to consider, for example, prostatic artery embolization and not some other surgical procedures that are associated with a higher bleeding risk for them.